Hi, and welcome to another episode in this ongoing saga of lockdowns, restrictions and social distancing. There's so much flying around on both sides of the fence regarding the current situation we all face. But I thought it was time to stop throwing stones, stop accusing others, no matter how obvious those accusations are, and try and avoid being pulled into the minutiae of detail that creates even more information white noise. In this episode, I had only need to visit one site, listen to one voice amongst the sea of media reports who seem hell-bent on flouting logic and creating an image which is having more of a negative effect on the hearts and minds of people than the situation itself. I will leave a link in the description below so you can check every facet of the detail, every named quote, and cross-reference every statement. In this respect, you will be able to share rational, logical, and reputable information with those who have been forced into a state of fear by what seems to be a minority of voices who have the ears of a majority of people. See you on the inside. Hi and welcome. First, I'd like to thank a subscriber and a student of mine who attended one of my masterclasses recently. His name is Mateus, who sent me the information to show you and for you to show others. I'm not going to get into he said or she said scenarios. You are all well aware of the media coverage, the paid expert's opinion based largely on questionable data. I want to give you the simple truth, nothing more, and what you do with that is your choice. I thought it appropriate to give you the brief speech Neo gave in his last scene for the movie The Matrix, and I'm sure you'll understand why. I know you're out there. I can feel you now. I know that you're afraid. You're afraid of us. You're afraid of change. I don't know the future. I didn't come here to tell you how this is going to end. I came here to tell you how it's going to begin. I'm going to hang up this phone, and then I'm going to show these people what you don't want them to see. I'm going to show them a world without you. A world without rules and controls, without borders or boundaries. A world where anything is possible. Where we go from there is a choice I leave to you. I'm sorry, you'll just have to forgive my dramatic intro. I couldn't resist. But the words will prove prophetic as we continue to fight against the machine of media hypocrisy, driven by the few while having a negative effect on so many. Let's jump to the site as I have a bit to get through, and I am sure it will help you have more orderly conversations with those who seem to take everything the mainstream gives them without checking the actual facts I am now going to share with you. At the very least, you may be able to start bringing some form of relief to those in fear of their own mortality when information is presented in a logical rather than emotionally driven way. So let's get over there now and we'll go through some of the glaring factual details. And remember, every single one of them you will be able to cross-reference with the appropriate professional and expert literature and reports. Here we go. Now we're on a site called Swiss or WSPRS.org, a Swiss doctor on COVID-19. And yes, I'm using that word now instead of Andromeda strain because these are true and factual. So let's have a look. Let's start. First published on March the 14th and updated on the 12th, so only 2 days ago. And this is a fully referenced facts about COVID-19 provided by experts in the field to help our readers make a realistic risk assessment. and it quotes, "The only means to fight the plague is honesty," quoted by Albert Camus in The Plague, the book, 1947. So first I'm going to start with some overviews, and then we're going to go on from there. Now, as you can see, I don't know if you can see, but up here in the top left hand corner, this is a huge document with all the facts and figures. Don't worry, I'm not going to go through all of this because I'm going to leave that to you, but I am going to go through the first part and one letter. So let's have a look at the overview. Firstly, according to data from the best studied countries such as South Korea, Iceland, Germany and Denmark, the overall lethality of COVID-19 is in the lower per mile range, and thus up to 20 times lower than initially assumed by the WHO. 2. A study in Nature Medicine comes to a similar conclusion. Even for the Chinese city of Wuhan, the initially significantly higher values for Wuhan were obtained because many people with mild or no symptoms were not recorded. 3. 50% to 80% of test-positive individuals remain symptom-free. Even among the 70 to 79-year-old persons, about 60% remain symptom-free and many more show only mild symptoms. The median age of the deceased in most countries, including Italy, is over 80 years, and only about 1% of the deceased had no serious previous illnesses. The age and risk profile of deaths thus essentially correspond to normal mortality. Okay, so only about 1% had no previous serious illnesses, which means 99% did. Many media reports of young and healthy people dying from COVID-19 have proven to be false upon closer inspection. Many of these people either did not die from COVID-19 or they in fact had serious preconditions such as undiagnosed leukemia. Normal overall mortality in the US is about 8,000 people per day. In Germany, it's about 2,600 people, and in Italy, about 1,800 people per day. Influenza mortality in the US is up to 80,000. This is normal influenza mortality. In Germany and Italy, up to 25,000, and in Switzerland, up to 1,500 people per winter. So are we up to or anywhere near these figures at the moment? I think not. And as you can see, these are all links that you can get for absolute fact checking. 7. Strongly increased death rates, as in northern Italy, can be influenced by additional risk factors such as very high air pollution and Legionella contamination, as well as a collapse in the care of the elderly and sick due to infections, mass panic and the lockdown itself. Number 8. In countries such as Italy and Spain, and to some extent Great Britain and the US, a serious overload of hospitals, notably by the flu, is not unusual. In addition, up to 15% of doctors and nurses currently have to self-quarantine even if they develop no symptoms, which then obviously goes to understaff those health systems itself. An important distinction concerns the question of whether people die with or indeed from coronaviruses. Autopsies show that in many cases the previous illnesses were an important or decisive factor, but the official figures usually do not reflect this. Thus, in order to assess the danger of a disease, the key indicator is not the often mentioned number of test-positive persons and deceased, but the number of persons who actually and unexpectedly develop or die of pneumonia. And what we're seeing in the media, which is not what number 10 is saying, is just the number of people that have tested positives. 11. The often shown exponential curve of corona cases are misleading, since the number of tests also increases exponentially. In most countries, the ratio of positive tests to total tests either remains constant between 5 to 25% or increases rather slowly. Countries without lockdowns and contact bans, such as Japan, South Korea and Sweden, have not experienced a more negative course of events than other countries. This might call into question the effectiveness of such far-reaching measures. And again, this is cross-referenced. According to leading lung specialists, invasive ventilation of COVID-19 patients is often counterproductive and causes additional damage to the lungs. The invasive ventilation of COVID-19 patients is partly done out of fear of spreading the virus through aerosols. Contrary to the original assumptions, however, the WHO determined at the end of March that there is no evidence of aerosol dispersal of the virus. Do you want me to read that again? At the end of March, the WHO determined that there was no evidence of aerosol dispersal of the virus, which means, what is the point by the end of March? Remember, folks, we're now in the second week of April and we're still on lockdown and we're still being told about social distancing when even the WHO has determined that there is no evidence of aerosol dispersal of the virus. So why are we still locked in our homes? A leading German virologist also found no aerosol and no smear infections in a pilot study. Well, he wouldn't if he knew anything about viruses, would they? 15. Many clinics in Europe and the US have been lacking patients, and some have had to introduce short-time work. Numerous operations and therapies were cancelled by clinics. Even emergency patients sometimes stay at home out of fear of the virus. Short-time work. And if given the overload we've been told about, let me just check one of these references. Okay, it's in American, so it should be, yeah. Okay, so hospital personnel are making particularly great efforts in the current coronavirus. However, half-empty hospitals are always available for emergencies. Because of the fear of virus, people should not hold back on emergency calls, he repeated for a call today. All right, so it says here, various hospitals therefore applied for or introduced short-time work. They give the reasons for this as the ban on non-urgent interventions. So there you go, another cross-reference. Current short-time work in hospitals sounds paradoxical. So as I say, every single one of these is cross-referenced. 16. Several media have been caught trying to dramatize the situation in clinics, sometimes even with manipulative pictures and videos. In general, many media outlets do not question even doubtful official statements and figures. The virus test kit used internationally are prone to errors. Several studies have shown that even the normal coronavirus can give false positive results. Moreover, the virus test currently in use has not been clinically validated due to time pressure. Let me just have a look at the prone to error reference for you very quickly. And this is in PubMed, so it's not some media outlet. We collected a study of 610 hospitalized patients from Wuhan between February 2020 2nd and February 17. We reported a potentially high false negative rate real-time reverse transcript polymerase, so RT-PCR testing. All right, there you go. And this, ladies and gentlemen, is in PubMed, and this is what's getting pushed out as the test, which, according to PubMed.gov, US Library of Medicine, isn't a valid test because of the false positive. So another interesting cross-reference from an official government source. Number 18. Numerous internationally renowned experts from the fields of virology, immunology and epidemiology consider the measures taken to be counterproductive and recommend a rapid natural immunization of the general population while protecting risk groups. So obviously the older groups and the very, very young and the people with existing underlying medical problems would be in the protected risk groups, and the natural immunization would be what we call the herd immunization, which, to be honest with you guys, the human body has been doing for millions of years and done very well, thank you very much. before the Gates Foundation decided to take over where nature had left off. 19. The number of people suffering from unemployment, psychological problems and domestic violence as a result of the measures taken has exploded in the US and worldwide. Several experts believe that the measures may claim more lives than the virus itself. Let me just read that one again. Okay, several experts believe that the measures may claim more lives than the virus itself. An NSA whistleblower, Edward Snowden, warned that the coronavirus is used for the massive and permanent expansion of global surveillance. The renowned virologist Pablo Goldschmidt spoke of a global media terror and a totalitarian measures leading British virologist Professor John Oxford spoke of a media epidemic. And so right he was. And again, every single one of these is absolutely reference. And then it goes on to all the new studies. April 12th, 2020, Stanford Professor of Medicine John Ioannidis concludes in a new study that the risk of death from COVID-19 for people under 65 years of age, even in global hotspots, is equivalent to the risk of a fatal car accident for daily commuters driving between 9 and 400 miles. And you don't see cars being locked down. In a serological pilot study, German virologist Hendrik Streeck comes to the interim result that the lethality of COVID-19 is at 0.37% and the mortality, based on total population, is at 0.06%. These values are about 10 times lower than that of the World Health Authority and about 5 times lower than those of Johns Hopkins University. But then if you figure out who actually gave lots of money to Johns Hopkins University, you'd figure out why they're higher. A Danish study with 1,500 blood donors found that the lethality of COVID-19 is only 1.6 per thousand, more than 20 times lower than the original assumed by the WHO, and thus in the range of a strong pandemic influenza. At the same time, Denmark has decided to reopen schools and kindergartens next week. A serological study in the US state of Colorado comes to the preliminary conclusion that the lethality of COVID-19 has been overestimated by a factor of 5 to a factor of 20 and is likely to be in the range between normal and pandemic. In other words, it's the normal seasonal flu. A study conducted by the Medical University of Vienna concluded that the age and risk profile of COVID-19 death is similar to normal mortality. But obviously, as you're being, or should I say doctors are being encouraged to write COVID-19 on death certificates, this normal mortality figure will be inflated in the incorrect manner. A study in the Journal of Medical Virology concludes that the internationally used coronavirus test is unreliable, which we've seen already in PubMed. In addition to the already known problems of false positives, there is also a potentially high rate of false negative results, i.e. the test doesn't even respond in symptomatic individuals, while other patients it does respond once and then not again. This makes it more difficult to exclude other flu-like diseases. And it goes on, but I'm not going to... As you can see, again, the WHO concluded at the end of March that, contrary to earlier assumptions, COVID-19 is not transmitted by aerosols through the air. Transmission mainly takes place through direct contact or by droplet infection, coughing and sneezing. So why are we on lockdown still? The German-American epidemiology professor Nut Witowski argues in a new interview that the COVID-19 epidemic is already declining or even already over in many countries, and that the curfews had come too late and had been counterproductive, he argues. Now, the rest of the document literally breaks down country by country. So I'm just going to cover the two relevant ones for most of my listeners. European mortality monitoring now shows a clear projection excess mortality in the over 65 age group in several European countries. In some countries, however, including Germany and Austria, mortality in this age group is still in the normal range or even below. The question remains open as to whether the partially increased mortality is due to the coronavirus alone or due to the sometimes drastic measures taken, i.e. isolation, stress and cancelled operations, and whether mortality will still be increased in the annual view. Among the age groups under 65 years so far in England, there is a projected increase in mortality beyond earlier waves of influenza. The median age of test positive decreased is 80 in Italy and 83 in Germany and 84 in Switzerland. So that covers European. Most of my other listeners, and you've got Germany, Austria, Switzerland, Scandinavia. Let's have a look at the USA and Asia. In the US, the authorities now also recommend that all test positive deaths and even suspect cases without a positive test results be registered as COVID deaths. The American physician and state senator from Minnesota declared that this was tantamount to manipulation. Furthermore, there would be financial incentives for hospitals to declare patients as COVID-19 patients. Some humour on this topic. I'm not going to click the humour on it, but they're actually paying hospitals to declare patients as COVID-19, even though they haven't tested positive. Right, so someone has seriously got to question, why are the authorities paying to declare COVID-19 deaths? It's always a case of follow the money. A COVID-19 field hospital near Seattle in Washington state was closed after only 3 days without admitting any patients. Just in case you didn't know, let's just check. Army Seattle Field Hospital closes after 3 days without treating a single patient. And this was April 10th. We're now 4 days ago on military.com. Look at this. They're all standing around because there's literally nobody to actually treat. What a surprise. The hastily built field hospital set up by the Army in Seattle's Pro Football Stadium is shutting down without ever seeing a patient. So the service can shift resources where they're more urgently needed. I mean, that says it all, really. That absolutely says it all. And I bet the media is still going absolutely nuts. And yet this is what's happening right at the same time. So I would love the mainstream media to explain why they have made no mention of this, and yet they're still pushing the lockdown, the vaccinations, and all the other stuff. So I will continue. Numerous media reports on alleged corona mass graves on Hart Island in New York. These reports are misleading in two respects. Firstly, Hart Island has long been one of the best known cemeteries of the poor in the US, and secondly, the mayor of New York declared that no mass graves are planned, but that unclaimed deceased, i.e. without relatives, are to be buried on Hart Island. So if you have seen any burials on Hart Island, then it's probably because of this and not the mass deaths that have created an empty hospital above. One of the leading Indian epidemiologists said that we cannot run away to the moon. He recommends the rapid development of natural immunity in the population, which is that herd population, which, as I said earlier, is something that humanity has been doing for millions of years without the aid of the Gates Foundation. Now, there's something else I want to show you, which is an open letter by Professor Blahakdi to the German Chancellor Merkel. And here is the open letter. Dear Chancellor, as Emeritus of the Johannes Gutenberg University in Mainz and longtime director of the Institute for Medical Microbiology, I feel obliged to critically question the far-reaching restrictions on the public life that we are currently taking on ourselves in order to reduce the spread of COVID-19 virus. It is expressly not my intention to play down the dangers of the virus or to spread a political message. However, I feel it is my duty to make a scientific contribution to putting the current data and the facts into perspective, and, in addition, to ask questions that are in danger of being lost in the heated debate. The reason for my concern lies above all in the truly unforeseeable socio-economic consequences of the drastic containment measures which are currently being applied in large parts of Europe and which are already being practiced in large scale in Germany. My wish is to discuss critically and with the necessary foresight the advantages and disadvantages of restricting public life and the resulting long-term effects. To this end, I am confronted with 5 questions which have not been answered sufficiently so far, but which are indispensable for a balanced analysis. I would like to ask you to comment quickly and, at the same time, appeal to the federal government to develop strategies that effectively protect risk groups without restricting public life across the board and sow the seeds for an even more intensive polarization of society than is already taking place. With the utmost respect, Professor, Doctor of Medicine, Shukarit Bach-al-Kildi. And here is the 5 areas. Statistics. In infectology, founded by Robert Koch himself, a traditional distinction is made between infection and disease. An illness requires a clinical manifestation, i.e. 1. Therefore, only patients with symptoms such as fever or cough should be included in the statistics as new cases. In other words, a new infection, as measured by the COVID-19 test, does not necessarily mean that we are dealing with a newly ill patient who needs a hospital bed. However, it is currently assumed that 5% of all infected people become seriously ill and require ventilation. Projections based on this estimate suggest that the healthcare system could be overburdened. So his question is, did the projections make the distinction between symptom-free infected people and actual sick patients, i.e. people who develop symptoms? Because we've all heard that you can test and come positive, and we all know why a majority of people would be positive, but you actually got no symptoms whatsoever, so you don't need a hospital bed, but they're giving you one anyway. It's almost as if they actually want to overload the hospitals, which, as you've seen in the military hospital there in Minnesota, they had to close theirs because they didn't have enough customers. Number 2, dangerous. A number of coronaviruses have been circulating for a long time, largely unnoticed by the media. If it should turn out that COVID-19 virus should not be ascribed a significantly higher risk potential than the already circulating coronaviruses, all countermeasures would obviously become unnecessary. The internationally recognized International Journal of Antimicrobial Agents will soon publish a paper that addresses exactly this question. Preliminary results of the study can already be seen today and lead to the conclusion that the new virus is not different from traditional coronaviruses in terms of dangerousness, and the authors express this in the title of their paper, SARS-CoV-2, Fear versus Data. My question, he goes on to say, is how does the current workload of intensive care units with patients with diagnosed COVID-19 compare to other coronavirus infections? And to what extent will this data be taken into account in further decision making by the federal government? In addition, has the above study been taken into account in the planning so far? And here too, of course, diagnosed means that the virus plays a decisive role in the patient's state of illness and not that previous illnesses play a greater role. Question 3, dissemination. According to a report in the, I'm not even going to try and say that, Zeitung Not even the much cited Robert Koch Institute knows exactly how much is tested for COVID-19. It is a fact, however, that a rapid increase in the number of cases has recently been observed in Germany as the volume of tests increase. Now, we've already read that the tests, by expert opinion, are unreliable. So it seems a bit obvious that the rapid increase in number of cases has been observed as the volume of tests increase. It is therefore reasonable to suspect that the virus has already spread unnoticed in the healthy population. This would have two consequences. Firstly, it would mean that the official death rate on the 26th of March 2020, for example, there were 206 deaths from around 37,300 infections, or 0.55%. is too high. This is what's already been said. And secondly, it would mean that it would hardly be possible to prevent the virus from spreading in the healthy population. So his question is, has there already been a random sample of the healthy general population to validate the real spread of the virus, or is this planned in the near future? I would suspect I could answer that one, which is no on both counts. Number 4, mortality. The fear of a rise in the death rates in Germany, currently 0.55%, is currently the subject of particularly intense media attention. Many people are worried that it could shoot up like in Italy, 10%, and Spain, 7%, if action is not taken in time. At the same time, the mistake is being made worldwide to report virus-related deaths as soon as it's established that the virus was present at the time of death, regardless of other factors. This violates a basic principle of infectology. Only when it is certain that an agent has played a significant role in the disease or death may a diagnosis be made. The Association of Scientific Medical Societies of Germany expressly writes it in its guidelines. In addition to the cause of death, a causal chain must be stated with the corresponding underlying disease in third place on the death certificate. Occasionally, 4 linked causal chains must also be stated. At present, there is no official information on whether, at least in retrospect, more critical analysis of medical records have been undertaken to determine how many deaths were actually caused by the virus, as we've said earlier, as opposed to they test positive for the virus but might have died of a heart attack or leukemia or whatever it is. So his question is, has Germany simply followed this trend of COVID-19 general suspicion? And is it intended to continue this categorization uncritically as in other countries? How then is a distinction to be made between genuine corona-related deaths and accidental virus presence at the time of deaths for all other things? And number 5, comparability. The appalling situation in Italy is repeatedly used as a reference scenario. However, the true role of the virus in that country is completely unclear for many reasons. Not only because points 3 and 4 above also apply here, but also because exceptional external factors exist which makes these regions particularly vulnerable. One of these factors is the increase in air pollution in the north of Italy. According to the WHO estimates, this situation, even without the virus, led to over 8,000 additional deaths per year in 2006 in the 13 largest cities in Italy alone. The situation has not changed significantly since then. Finally, it has also been shown that air pollution greatly increases the risk of viral lung disease in very young and elderly people. Moreover, 27.4% of the particularly vulnerable population in this country live with young people, and in Spain as many as 33.5%. In Germany, the figure is only 7%. In addition, according to Professor Reinhard Bruce, head of the Department of Management in Healthcare at the TU Berlin, Germany is significantly better equipped than Italy in terms of intensive care units by a factor of about 2.5. So his question is, What efforts are being made to make the population aware of these elementary differences and to make people understand that scenarios like those in Italy and Spain are not realistic here? And now all of these numbers, obviously, that he's put within his questions and his letters are all referenced down here very, very professionally. And Professor explains in this open letter. So this is the guy who some of you YouTube's video I'm sure you've actually seen. And as you can see here, this document goes on and on, covering Germany, Scandinavia, USA, as I said, and that open letter for northern Italy. Here you can see here, this is the Italy just here, rest of Europe, UK up over here. Now look at this dark red patch. This is winter smog, NO2, in northern Italy in February of this year. And yet, as you can see quite clearly there, if I can bring that back a bit for you, there you go. So it's also, so let's just have a look. Northern Italy, since we've spoken about it in the letter. Regarding northern Italy, several potential risk factors have already been discussed. It is true that 2 major vaccination campaigns against influenza and meningococcus were carried out in Lombardy in the months immediately preceding the outbreak of COVID-19. So what we're saying here, folks, is vaccination campaigns against influenza and meningococcus were carried out in these exact same regions. Ain't that a coincidence? In the month immediately preceding the outbreak of COVID-19, notably in the latter hotspots of Bergamo and Brescia. Although it is theoretically possible that such vaccinations could interact with coronavirus infections, such a possibility has not been established at present. Yeah. It's also true that the high asbestos exposure was present in northern Italy in the past, which increases the risk of cancerous lung disease. But here again, there is no direct connection with COVID-19. Nevertheless, in general, it is true that the lung health of the population in northern Italy, as you can see here, has been affected for a long time by high levels, and here we show the air pollution and other detrimental factors, making it particularly susceptible to respiratory diseases. And as you can see there, but they're all being put down to COVID-19 and no mention, I must admit, in all of my research, I had no idea that 2 major vaccinations had taken place just prior to the COVID-19 outbreak in Lombardy, along with the smog that you can see here. Let me just round up this particular episode, and as I say, I will leave the links to this whole report, and it goes on and on. So if you've got anybody that doubts anything that's being said, I mean, this goes on about political developments, ventilation with COVID-19. I'm not going to bore you with all of the details, but political developments, NSA whistleblower, architecture of oppression, contact tracing. It goes on about a task force to eliminate false reports about COVID on the internet. However, freedom of expression remains untouched, it was said. Yeah, how can you possibly have freedom of expression if you are going to decide which reports are false or true? And I hope that people looking at this particular episode of the observation deck, none of it is false. All right. So I'll just want you to be able to share every possible thing you can about COVID-19, and it goes on with the dates, and it tracks absolutely everything. So let me just round up this episode, and please share this, support the channel, and please don't be scared of COVID-19. Please don't allow fear and stress to increase an already challenging situation that's going on in the world at the moment. I just want you to know the facts about COVID-19, backed by all of the references by medical professionals and some of the best people in the world in their field. All right. So, and if anybody asks now, or you need even further references, well, you know now exactly where to go. Let me just round up and get back to the episode. Well, as you saw there, it seems clear the media has a lot to explain when it comes to reporting the actual deaths attributed directly to COVID-19. The fact that doctors and hospitals are being paid to effectively manipulate, or as some would say, falsify death certificates, going against established protocols, is in itself tantamount to criminal negligence or criminal charges and activities, and those responsible should be held to account to explain their actions. There was a time when the media had what we called investigative journalists, which, according to what we have covered in this episode, have morphed into nothing more than reporters of highly questionable information, manipulated to suit the sensationalism that promotes fear, and, as pointed out by some experts, could actually be contributing to more stress, harm and even deaths because of its neglectful reporting. I would ask the mainstream to explain the speed in which they report the data which has clearly created a state of fear in many of the world's populations and yet seem to remain quiet along the closing of facilities since they are not required. Even a single facility, as you saw there, constructed to house the patients arising from dubious data. And it's that duplicity which is borne out by the closures itself. Will it be the case that their own UK-based Nightingale FEMA camps will not see the patients they were designed for? And could it be that the real numbers attributed to actual COVID-19 deaths be no more than stated by this large body of experts, which, as many have stated, is no more infectious than any other coronavirus of previous years, or as you and I would call it, the flu season? And if this be the case, and it looks like it is, the question then arises as to why senior officials are still calling for lockdowns and extensions to them until we find a vaccine, when in reality, according to what we have covered here and by the World Health Authority's own updated reports, we actually have no need of. And I found it particularly interesting that Lombardy had vaccinations prior to the COVID outbreak this year, and with the established data held by the World Health Authority and the Italian government of the various pollutants in that region, which, I might add, is basically because the mountains to the north trap everything coming up from the south and form a concentration of those pollutants. And yet the media continue to cite Italy as a focal point, but again without any reference to the clear-cut mitigating circumstances I have shown you today. I hope you share this factual report, which in itself is a sad state of the current world affairs when a guy in his shed has to do the job of real journalists and the ones they used to be paid for. Where has the pride, the morality and the conscience gone in today's media? And just how long we, the public, have to put up with cherry-picking the data to push a narrative rather than tell the whole truth. Anyway, like, share and support my work through the normal channels in the description below via PayPal, Patreon or Bitcoin. And remember, this has been Robert from the observation deck doing the job that mainstream seems incapable of. So until next time, question everything, believe nothing, and stay curious, and I'll see you on deck very soon.